Federal health officials are cutting the number of recommended vaccines for kids. Under the new guidelines, some immunizations, including those for hepatitis A and B, meningitis, rotavirus, and seasonal flu, are now more restricted. They're recommended only for those at high risk or after consultation with a healthcare provider. President Trump announced the change on Truth Social, saying in part, quote, "This schedule is rooted in the gold standard of science and widely agreed upon by scientists and experts all over the world. Effective today, America will no longer require 72 jabs for our beautiful, healthy children." The American Academy of Pediatrics is condemning the change, calling it both dangerous and unnecessary. The group says it will continue to publish its own childhood vaccine recommendations. Dr. Amanda Kravitz is here in Studio 57 with me to break all this down. She is a pediatrician at Weill Cornell Medicine. So, Dr. Kravitz, so good to see you. This is really confusing, especially someone as a mom of two young girls.
Yeah.
The 72 jabs is over a period of years, right?
Absolutely. So that's when they're looking at the entire vaccine schedule. That's also factoring in every annual flu shot and every COVID vaccine. So the 72 sounds very high, but it's not really 72 different vaccines. They use that as a little bit of a fear tactic to make it seem like we're really giving too many vaccines when that's really not the case.
So what are these different groups?
So the new system that came out yesterday has three different categories. It has the vaccines that are still recommended for all children. It has the vaccines that are recommended for children that are high risk. And then it has the vaccines that are no longer recommended for children. They can only be given based on shared decision making with your clinician. So that's very confusing, I think, both for patients, for families, and also for us as pediatricians. The documentation really didn't come out with information about what the high risk category even is. They used an example of children with lung disease, but it's really leaving it up to the doctors to determine which children would qualify for which vaccines.
So federal health officials are also comparing this to the vaccines that children in other countries get. I hear Denmark a lot, but experts are saying this isn't a fair comparison. Why is that?
So I think it's an important thing to note that vaccine schedules are not one size fits all. And by that, I mean, just because something is working in Denmark does not mean it's going to work in the United States. The USA is a very, very unique country. We have 50 times the population compared to that of Denmark. So what's working in Denmark is probably not going to work in the United States. The population needs, the illnesses that are affecting the children and the population of the USA are different than that of Denmark. And so we can't just say, well, we like what they're doing there, so we're going to adopt it in the U.S.
Okay, I want to ask you about something else that a lot of people are watching out for in this region all over the country, and that is flu. I saw your Instagram, you posted that we are seeing way more cases than you would typically see. I've got my elixir here. I don't even know if it's going to work, but I am doing anything I can. What should we know about the flu season? Is it still too late to get the flu shot?
So it's such a great question. Thank you for bringing this up. This flu season is really intense. It is one of the worst flu seasons we've seen in years. We are seeing an increased number of hospitalizations. We are seeing much more severe symptoms. We are seeing a higher rate of pediatric deaths this year. And it is based on this variant, the H3N2 variant of flu A. It is absolutely not too late to get your flu shot. I am encouraging everybody to get their flu shot if they haven't already. Even if you had a variant of the flu, once you're recovered, I'm still encouraging you to get the flu shot to protect you from a different variant that could be coming about. The best thing to do other than getting your flu shot is washing your hands and trying to avoid spending time with people who you know are actively sick.
Okay, good advice, Dr. Amanda Kravitz. Thank you so much.